My name is Emberly Lopez Escobar. I am a first year at Dominican, and this is my first year doing service learning. My service learning experience was at Rotacare Clinic, which is located downtown San Rafael. And their mission is to ensure that everyone is able to have the proper health care that they need. So that's like regardless of their income status, their insurance status, their immigration status. So what they do is that once a week, it's either on a Monday or on a Thursday, they open up a clinic and you can basically just walk in or you can make an appointment and they ensure that you get the proper treatment that you need. There at the clinic, I mostly served as a Spanish interpreter, but I also helped with registration and scribing. And each role showed me how essential communication, cooperation, and shared knowledge are in healthcare. I learned the most when I was interpreting just because that's what I did the most. I realized quickly that it's not just about translating words, but it's actually about translating tone, emotion, and sometimes even culture. One aha moment that happened to me while I was interpreting was with a physical therapist, where a patient described her pain using like a metaphor that a lot of us Spanish speakers use, which is like el dolor camina, which directly translates to like I have a walking pain. But her pain wasn't when she was walking. It refers more to like the pain is like moving, it's spreading around. It started in one place and it started spreading around. So I realized that without someone there to understand what she actually meant, the provider might have misunderstood her problem and might have treated her like, not like treated her wrongly, but like wasn't able to like treat her effectively. So helping her communicate clearly showed me how central communication is in order to have a good healthcare. Another really big insight was also when I was working with the clinic's nutritionist. Obviously, we were talking about food, but one thing I learned wasn't really about the food. It was more about how food was like connected to traditions, was connected to the culture, was connected to work schedules and families' routines. Specifically, when the nutritionist was trying to have the patients change, it could either be like their diet or the way they eat. But quickly, I realized that it's not really like a one size fits all. The nutritionist, she kind of has to like see and understand each patient's culture basically and the way they eat and kind of have to like shift her treatment to best fit all the patients. So I also learned that healthcare must be personal, flexible, and also culturally aware. And I also worked as a scribe. Oh, I think I forgot to mention this, but I was in Dr. Taylor's Evolution to Humans Cultures class, and there we learned about collective learning. And working as a scribe, it taught me how much modern healthcare relies on collective learning, which is connecting to the class I was part of. So, accurate documentation in today's version of early human tools for storing knowledge, and it also keeps information moving across providers and prevents mistakes or errors. My time at the Rotacare also depended on my understanding of inequality. We are mostly working with a minority group here in Marin County. Many of my patients were low income Hispanic workers with limited English, and most of them had no insurance. One specific moment which really opened my eyes to this was when a patient told me they were like very scared, they were very worried. And they told me, I work every day, but I'm always scared of getting sick because I can't afford it. And that really stayed with me and like it made a really big impact because I realized like people are scared to go to the doctors, not because like they don't like the doctors or like they don't like needles or something like that, but they're scared because of like they can't afford it. Like they might go into debt just to get a basic need treated. So I feel like that also really impacted my view on community here in Marin County and also just how impactful Rotacare is to a lot of people. Going off of community, I feel like after my experience serving at Rotacare, community doesn't only mean about like people or like where you are, but it really means to me like how much people support each other even when systems fail them. It also means cooperation and working with one another, showing dignity and having shared responsibilities. And this experience also showed me that working with community partners is essential to real education. Like, don't get me wrong, education is very important, and textbooks can teach you about concepts like inequality and stuff like that, but it's really where you really like get a grasp of it when you work hand-on experiences with a community partner, like for example, Rotacare or other community partners that other people have shared. So it really helped me connect my classroom ideas with real human experiences, and it strengthened my desire to work in a field where I can bridge the gaps and access in communication. So I really do recommend it for anyone who is really wants to get that hands-on experience and really want to learn more than just like being in the classroom. Thank you.